This podcast is sponsored by the Cherokee County School District in Canton, Georgia, and produced by children and adults with ADHD, CHAD. Welcome to ADHD 365. I'm your host, Susan Booning, and I'm here today with Dr. Carrie Heller to talk about emotion regulation in children and adolescents who have ADHD. Good morning, Carrie. Can you tell us a little bit about yourself?
Sure, absolutely. Good morning. It's great to be here. Thanks a lot for having me. I'm Carrie Heller. I'm a clinical psychologist in private practice in Bethesda, Maryland. I specialize in the evaluation and treatment of ADHD and related executive function issues. I'm also chapter coordinator for the Montgomery County chapter of CHAD and one of the co-chairs of the editorial advisory board for Attention Magazine.
Carrie, why do children with ADHD have difficulties with emotion regulation?
It's a good question. So if you think about ADHD, one of the core deficits with ADHD is the idea of self-regulation. So probably thinking about attention is the most common thing people think about with ADHD. So the idea is a child or anyone with ADHD has a hard time with regulating their attention. Same thing with hyperactivity. So excessive movement, again, it goes to self-regulation. So similarly, if you think about emotions, the same idea is children with ADHD often have trouble controlling their emotions because it gets at the same core deficit of trouble with self-regulation. So there's the aspect of the self-regulation piece with emotions. It's kind of add to issues. Sometimes, people with ADHD can get overwhelmed easily. So that makes it hard to control emotions. Or also there are some situations where if you think about it, if someone's not paying full attention to what's going on around them, they may make these assumptions of what's going on in a situation without actually looking at all the available information. So they may make these erroneous conclusions and then as a result become emotionally charged or dysregulated when there's really not necessarily even a reason to be based on the circumstances.
Is there a growing recognition that children and teenagers with ADHD tend to struggle with this emotion regulation?
Yeah, I do think there's definitely a growing recognition because it's not something that's really focused on directly that much in the actual criteria for ADHD, but it is something that, so for example, think about Thomas Brown's book, Smart But Stuck, which focuses on emotions in teens, adults with ADHD. I think that's one good example of this trend. Another example is the Brief 2, which is a measure of executive function skills, which really underlie ADHD. They actually, when they redid the brief questionnaire in the last couple of years, they created a separate emotion regulation index. And so with that, it looks at the ability to shift attention as well as emotional control. And so what that illustrates is that the emotional control is really vital to ADHD and executive functioning. And so I think those two things in itself really illustrate the fact that there is this growing recognition.
How can a parent recognize triggers that could be increasing the dysregulation? For example, medication rebound effect, or when medication is wearing off, or any other triggers?
My suggestion would be, in general, keep a log of what's going on. So if you notice, if your child or teen suddenly starts reacting very strongly, note the day of time, what was going on right before it, because you can pull this information in a nice organized fashion and then figure out, are there consistencies? So if it's occurring whenever the medication is still kicking in or wearing off, that obviously is really useful information to know. Is it that anytime they're being told, oh, you have to sit down and do your homework, that's when it occurs? So looking at the triggers can be really helpful in figuring out when the dysregulation's occurring, and in turn also can then be used to help with ways of addressing it to reduce the dysregulation.
How can parents recognize that there may be something more than the standard emotion regulation difficulties in ADHD? For example, indicating the presence of a coexisting condition such as oppositional defiant disorder, emotional disturbance. How can parents know when there's something more?
It's good for parents to look for a couple of things that I'll mention, but in general, this is probably something that may be better left to professionals to ultimately determine. But the things that you can look at to help decide, should you reach out to a professional about the emotion dysregulation issues would be looking at the frequency of them occurring, the severity, specific triggers, and the consistency. So if a child is always reacting to, let's say, when the medication wears off, or when, let's say, working on homework and it's especially tough, that it's sort of a very identifiable trigger. But if it's just completely random, you can't pinpoint it, or you get very different reactions to the exact same situation, that can also suggest that there may be something more. I would also, probably the biggest thing, whether it's truly due to ADHD or something else, is think about how much of an impact does it have on daily functioning. So if you have a child and they're constantly, you feel like you can't tell them no because they're going to react strongly, or you feel like, you worry about how they're doing at school because anytime something's tough, they sort of give up and, run out of the classroom. Those types of things clearly, no matter what the cause, are going to have a significant impact. So you want to figure out, when those are occurring, ideally figure out what is the cause, and then in turn, figuring out the best way to address it.
How can parents or caregivers help a child socially when emotion dysregulation comes into play with relationships?
I often view, in terms of addressing the emotion regulation piece, I sort of view strategies as coming into kind of two main categories. So we have proactive strategies, which are things that you can kind of do to prevent the dysregulation from occurring in the first place. So these are often things that would be helpful for a variety of reasons. So for example, getting enough sleep, eating healthy, not being really hungry when you're going to social interactions. Think about the Snickers commercial. You probably want to avoid that type of kind of being that hungry when you're going into kind of a social situation. Things like practicing mindfulness, breathing exercises on a regular basis, getting enough physical activity. These types of things in and of itself can help mitigate emotion regulation trouble to some degree, and obviously help address lots of other issues as well. Another kind of proactive strategy is the idea of planning ahead. So thinking about the structure. So with the social situations, especially for younger kids, if your child has a friend over and they say, "Oh, just go play," for some kids that can be fine. For other kids, that can very easily lead to conflicts over what activity we're going to do, or someone is very competitive, gets very upset if they don't win at a game. So being able to maybe help the child ahead of time to think through, what are like 3 activities we could do, and let's maybe pick one, and then if my friend wants to do something different, say, let's do one first and we'll do the other after. But sort of having a general framework to work with for kids can be really helpful for creating these, for the social relationships. I think the other thing to add to that would be to also think about the more that your child can do a lot structured activities with others. That's also a really good way to mitigate some of the issues and to help practice things. Because I think so for example, doing some sort of structured after school activity, because it provides social connections, and there's probably some informal interactions as well, but because there's more structure, there's probably less of a likelihood of having a strong emotion dysregulation from it. The other part of it is to really think about reactive strategies. So what do you do in the moment when something occurs? It's great to try to prevent the emotion dysregulation from occurring, but obviously there's only so much you can do. So a couple of strategies that can be really helpful for parents in social situations would be having the child being able to do a really quick deep breathing activity, whether it's taking 3 deep breaths in and out. Something like that is good because that one can be a little bit more discreet. Than certain other ones, involve having to listen to something like a mindfulness activity or using an app can be really helpful, but that obviously involves them having to either do it in front of their friend or, take a break from their friend, which, in some cases for young kids may be fine. For others, may create some issues in terms of, embarrassment and things like that. I do think when necessary, having kind of a good exit strategy. So if a child has a friend over or they're at a friend's house and they feel like they're starting to react very strongly, figuring out, can the child just say, "Oh, I need to go to the bathroom," and then maybe have whatever the activity is, hidden in the bathroom that they can pull out really fast to do, have headphones and listen to it, on a tablet for a few minutes, or have something in their pocket that they can go into a bathroom and just use in order to kind of help calm themselves down. Changing the focus can also be another strategy. For some kids, if you can give them something that suddenly changes their focus away from what's bothering them, they can shift their focus easily and then are fine. Other kids have a hard time, they get really stuck on what's bothering them in that moment. So I think everyone's different, but figuring out if there are things that you can give your child that will suddenly change, get them to be able to refocus in.
And aside from social situations, are there strategies parents can use to help increase emotion regulation in their adolescents and children?
I think the idea I mentioned earlier about the proactive and reactive strategies, like you can apply that same concept in general. So like a proactive strategy, not just in relationships, but in general, would be helping children to learn and identify specific emotions. Because a lot of times, if someone's feeling very overwhelmed, they may not even be able to articulate in that moment because they're so overwhelmed. Are they feeling angry? Are they feeling anxious? Are they mad? But if you can get your child or teen to say, "I feel really angry. I feel really nervous." And then from there, so insert why, kind of have like a framework. I feel angry because I just lost at this game. Or I feel angry because I'm not good at this game. So if you can kind of get them to do that, it takes away some of the ambiguity in their mind. and in itself can help them to calm down at least a fair amount. May not magically make them fully calm again, but it's a really good starting point because it snaps them out of this, I'm so overwhelmed with emotions, I've shut down completely. Because if you can stop the complete shutdown, it makes it easier to work through. So in addition to that, I also think sometimes for kids, being able to identify the severity of a specific emotion is helpful. So, something I work a lot with kids on is creating, let's say, an anger chart, where maybe you rate it from 10 to 100. And, obviously you don't want to create the chart when you're really angry in the moment. The idea is to do this at another time and to maybe say a 10. So maybe a 10 is I lost at a game. Maybe a 50 is my parents said I couldn't go play with my friends. Maybe 100 is my pants split and I was very embarrassed because it happened during recess at school. That's basically because the idea then is it help. And then what you can do is have your child either, use the chart visually in the moment or just remember to rate, so you can ask them, how angry are you right now? So once they label the emotion, have them rate how angry they are or how anxious they are. You can do the chart with, anxiety and other related things as well, because then it puts it in perspective. So for example, if someone says, oh, I'm actually at a 20 for feeling nervous about this, obviously it's important to them, but that's very different than feeling they're at 100. And so it also kind of like labeling the emotion, labeling the severity also can help them to kind of reduce that just being so overwhelmed that they can't function and be able to put it in perspective. Other things that parents can do that can be helpful are certainly, praising your child when they're identifying emotions and doing what they should be doing. Because for some kids, just a little bit of praise can also help them to feel better. So if a child who's had a hard time emotion regulation is suddenly able to say, I feel really angry, like in a nice way, say, I'm sorry you feel the way, but I'm really glad that you're able to vocalize that to us. That's great. Because that in itself can also actually work well to actually shift some of the focus away from what's bothering them too. Other things that are really helpful are, in general, modeling good emotion regulation yourselves as a parent or caregiver. I realize sometimes this is probably easier said than done in the moment. Because if you think about it, like let's just for a second think about if you're having an argument with another adult. Chances are if one person starts yelling, you're more likely to get revved up and potentially yell back. And the same thing, if your child starts yelling, you may feel like, oh, I need to yell either just because you're angry or feel like that's how you get through to the child. But the idea is basically if you can stay calm and model that, your kids are more likely to follow through and do that too. I know, again, it can be difficult in this situation. And so sometimes there's strategies you can use yourself. Actually, some of the same ones I've mentioned in terms of, mindfulness activity, being able to recognize your own triggers and try to avoid them when you can, or have a simple strategy to use. So if you know that you're really triggered when your kids fight, maybe you say to yourself, I'm going to, in my own head, rate how angry I am about this. And then I'm going to take 3 deep breaths in and out in order to be calm enough to sort of manage whatever's going on with these 2 kids.
What interventions target emotion regulation in adolescents and children with ADHD?
There are a couple. So, certainly if you have a child that's participating in psychotherapy, using various kind of behavioral tools, looking at kind of thoughts and sort of replacing certain thoughts and connecting out behaviors can be helpful. Being able, as part of that, there's also a lot of CBT tools involve various worksheets to kind of practice, or even the different charts you can use, where you kind of, for kids, especially younger kids that have a hard time even thinking about emotions, you may see these little like sort of face charts. If you Google emotion chart, there's usually a chart that pops up that shows, probably at least 20 different sort of faces and different emotions. And so that can be a good starting point for kids who just don't really know how to label emotions. That's sort of one type of strategy. Other strategies can be really helpful are doing a mindfulness activity. The one thing I will say, so for kids with ADHD, first of all, you probably do not want to try to teach them a half-hour mindfulness activity because they're probably not going to stay focused for it. The idea is, first of all, each child is different. So you want to figure out what they're willing to try and go through different ones. For younger kids, sometimes using a mindfulness activity that's on an app that has a visual piece too. Like there's one called Meditation for Kids, for example. So that is great because they show pictures, let's say, of a forest or various animals, and then there's the script part that's going through, so you're listening. But because there's that visual piece. Same thing with, Go Noodle as another example. There's some mindfulness ones on there that are good. And so this allows you to, or the child to be able to visualize, this is what I'm seeing, but then I'm also kind of hearing it at the same time. So it helps them to stay more engaged and be able to work towards calming down. Deep breathing can be really helpful. So for example, taking 3 deep breaths in and out. Another one is called guided visual imagery. So this one, it's a little similar to mindfulness. The difference, though, is rather than focusing on kind of a direct focus on what's going on, you focus on kind of breathing, but at the same time, you're imagining yourself somewhere else. So maybe it's you're walking through a forest and you're listening to the sounds of the birds chirping or the leaves rustling in the wind. And then maybe you walk to a beach and you hear the sounds of the waves as they're, crashing against the shore. Or you can, that's probably a fairly standard example. I mean, you could, create your own. There's a website, innerhealthstudio.com, for example, that has all typed out scripts. So you can basically pull that and, modify it to make it your own. So, for example, sometimes the kids, if they really like, an amusement park, figure out like the sights and sounds and how you would describe it, and you can even record it, and then they can play it themselves, in the moment when they need something to calm down to be able to take their mind off whatever's going on. There are also various, card and other types of games out there that you can buy online to practice emotion regulation.
What resources are available for parents and caregivers that could help them to help their children and teenagers?
There's definitely a lot of information available. So, there's Thomas Brown's book that I mentioned earlier, Smart But Stuck. Chad has a huge wealth of resources. There's the toolkit. There's tons of articles on the website. You have Attention Magazine. You have the blog. There's lots of things in there that are really, and there's definitely a focus on a good part of that, emotion dysregulation. There's also, if you just look online, there's lots of things. The idea, and also I would say consult the provider that you're working with, pediatrician, because they can also direct you to figure out what resources are going to be best for your child. I think the thing that you want to keep in mind is that anything you pull, whether it's from a book or an online resource, that's sort of more of a general thing. And while they may work for lots of kids with ADHD, everyone's different. So just because a strategy or tool works for one child that's based on whatever's written in a book doesn't mean that strategy is definitively going to work for your child based on their individual circumstances. So I think you want to take the ideas that you find online or in books, but in a lot of cases, working with someone directly who knows your child can kind of help you to tailor them to meet the individual needs of your child is really important.
Carrie, is there anything else that I didn't ask you about that you'd like to tell parents and caregivers?
Sure. I mean, I would say the main thing I'd like to convey is that, I know it can sometimes be very frustrating when you have kids that have a hard time with emotion regulation. Sometimes it can really impact, activities that you do with them, or make you very nervous about, what happens if I take them to public and they have a meltdown? And so the idea is that I know that can definitely be very tough. At the same time, I think it's important to do what you can to address these issues, not just because of how it impacts you in the moment, but obviously it impacts kids themselves tremendously and can get worse with age if you don't address it. And so, but the idea is there's a lot out there in terms of, support you can get from providers, resources, things you can read on. But, I think when in doubt, don't just sort of say, let me just keep trying the same thing and hope it works. Because chances are, if you keep trying the same thing over and over again and it's not working, you're probably not going to suddenly get a different result. So the idea is, there's definitely a lot of room for improvement with kids with these issues, as well as ADHD in general, but you have to seek out the support to do it. So that would be my final thing, is just, if your child is not sort of managing things the way you would like them to, seek support and do what you can to help them for themselves, so they can really function well in childhood and into adulthood with managing these things, so it doesn't impact them and they can thrive in the way that they'd like to as an adult. In the same way, I'm sure you would like them to thrive as well.
Thank you so much. There's certainly a lot of good advice for parents in all of this.
Oh, you're very welcome. Yeah, thank you very much for having me.
This podcast is part of the Cherokee County District's Parent University series and the CCSD Cares Initiative, cultivating achievement, resiliency, and the empowerment of students. CCSD's vision is that all students will thrive today, tomorrow, and throughout life with a sense of purpose and self-worth.
Thank you for listening to another episode of ADHD 365.